Hello everyone, I am Dr. Thawab, co-chair of ISPRM Communications Committee, and today I have with me Dr. Pauline, who has just delivered an amazing lecture on strengthening rehabilitation in health systems around the world. So Dr. Pauline, can you tell us about the key approaches for strengthening of rehabilitation?
Sure. So probably the key approach is to, first of all, bring the stakeholders together and recognise that something needs to be done, and particularly bringing government to the table to be discussing how they can strengthen rehab. And then this often converts to a conversation about what should be done, and that's often planning, integrating rehab planning or integrating into other health planning. It can also be around developing the workforce and really supporting workforce. And when I say workforce, of course PRMs, but often it's the allied health, the therapists that also need support, particularly in low and middle income countries. Of course, financing is a big area to address, and when we strengthen rehabilitation, we really want to ensure that it's integrated into health financing mechanisms and included in the definition of health benefit packages. So they're some of the key approaches, but there's much more. For example, service planning, we can really need to support that quite a bit. And I will just say also in the context of this ISPRM Congress, talking about technology, it's really important we're also thinking about building assistive products and the financing, the procurement, the distribution, the provision.
Yeah, so for a country who wants to embark on the strategic planning for rehabilitation, so what are the main components that you say that countries should, follow?
Yeah, okay. So strategic planning can be a really useful approach for countries because it brings the stakeholders together, as I mentioned earlier, and really takes them through a process to recognise where they are. So to understand their situation, and we do that through a situation assessment, and we generally develop a technical working group who help guide the situation assessment and use maybe consultants or people to support the ministry to undertake that process. Then we ensure that the assessment's finalised, people are aware of the findings and agree to then move to strategic planning. And the strategic planning process, again, often involves the stakeholders coming together, typically in a workshop. We do that typically in a 3-day intensive workshop, and we draft a plan, and it's very common for, again, the consultant to be there supporting the government and supporting the stakeholders to draft the plan. And when you draft the plan, it takes thinking about the vision, what you want the future to be, talking about priorities, talking about the key objectives, and then identifying those actions and steps to achieve those objectives. And normally what we do is over an intense workshop, we come up with a preliminary draft, and then there's rounds of consultation and review, and we create a monitoring framework so that we can really track the change once we've completed and once it starts being implemented. And I think, strategic planning, I often say that the process of bringing people together, the conversations, is as important as the document that comes out of it, the 5 or 10 year, mid to long term plan for rehab, because bringing everyone together and creating those shared visions and understandings and ways forward is super important.
Okay. So you have been directly involved in helping countries make this strategic rehabilitation plan. So what is that like? I mean, for example, recently we just listened that you have helped Jordan make the strategic plan for up to 2024. What was that experience like?
Yeah. So in the case of Jordan, let me say it wasn't me in the country doing. I actually supported remotely, but the colleague, we had a consultant who went and first of all, the country office, the Ministry of Health and country office, decided to do it. and there's discussion and there's quite a bit of planning and preparation, because just getting to that stage of agreeing that we'll do a comprehensive assessment and then a strategic plan takes prep, takes planning. Then in the case of Jordan, we collected data. So the government, the ministry and the key people involved collected data to essentially understand where their services were, what the workforce was composed of, the numbers, and we were able to get what I would kind of characterise as baseline information. And then what happens is the consultant often comes in and is in the country for a couple of weeks, and they undertake a series of meetings and focus group discussions with different stakeholder groups. They visit different sites and they essentially work through, there is a bit of a framework they work through in order to complete the assessment. So then they write the assessment, that's agreed, and then in the case of Jordan, they returned and then they went through a process, where they get met in a workshop and developed the plan in a collaborative way with stakeholders. And basically the plan gets drafted and finalised in the following months. And then we finish it and the government endorses it, we launch it and really implement it. And implementation is what counts. It's the most important part, really.
Yeah, planning is just the first step, right?
The planning and the developing of it is one half, or not even a half, 1/4, but it's the implementing that's so important. And the concept of implementing a rehab strategic plan is really important, because people often develop them and then they can sort of forget about them and they sit on a shelf. But their purpose is to then inform the annual planning or the biennial planning, to make sure that 5-year or 10-year plan gets pulled out and informs what goes into those budgeting and planning cycles within government, but also within the different stakeholder groups that implement the activities. Because in a rehab strategic plan, obviously some of it government may do, but we often try and bring other stakeholders in to really recognise, it could be academics, it could be professional associations, it could be international NGOs or development partners who are really helping support or do some of the activities.
If I was to summarize this process, so first of all, the Ministry of Health of that country has to go and approach WHO. And then they would send a consultant, and then they all will work together along with the various stakeholders and come up with a plan that will then be implemented, and then it will be reported back and forth in the following years to know that it is really implemented in that country. So I think because of the advantage of last year's WHO resolution on rehabilitation, so all the physiatrists and allied healthcare professionals can now have that document, and they can tell their Ministry of Health that now they need to go and approach WHO for strengthening and formation of a strategic rehab plan for their country.
Potentially, that's right. They can really use that resolution to remind their governments that their governments have endorsed that resolution, have made a commitment to strengthen rehabilitation, and they can use it to really encourage the ministry, particularly ministries of health, to take action. And the action may or may not be strategic planning. It is possible that there's another entry point. There's some other activity happening. For example, they could be developing an essential services package, and the first priority is to work with them to really help define what rehab services should be in what level. But if the timing's right and it's the right thing for the country, right time, right place, then that's right. Strategic planning is a really useful step forward for many countries.
And there are many technical products as well, which can be used by the country. So would you tell us briefly about some of them?
Quite a few. So we have technical products that really reflect different work areas based on the health system building blocks. For example, the Rehab Guide for Action guides the strategic planning. We have a resource that can guide some of the decision making in financing. We have the WHO package of interventions for rehabilitation, which is very helpful when we're defining benefit packages, but also for informing, other service decisions. We have the competency framework for the workforce, rehab competency framework, a deep dive evaluation tool for the workforce. We have also our rehab module that could be included in the health facility reporting. We have lots of guidance for assistive technology and really how to, again, procure, the specifications, streamline the procurement, support the provision. We also have products that are supporting emergencies, preparedness and response. So there is a lot, but no country has to use them all, and certainly not at once. We see it's like a menu of options. Strategic planning can often be a logical step to take, an initial step. It's not the first step. Countries have activities that are often happening. Strategic planning can be useful as then a step to really help prioritise. And then after that, often we can identify which of those products should be used first or second or third. And all just based on the country needs.
So we will provide the link to these technical products in the description below to this video. So I would like to thank you, Pauline, for giving us your time and talking to us about this. Thank you so much.
My pleasure. Thank you.